And now, back to the Dr. A Show with your host, Dr. Will Aguila.
Better living through chemistry? Well, maybe not. There are an estimated 80,000 chemicals in common use today in all sorts of products that you see every day. The EPA has been able to require testing on only 200 of these, and only 5 have been banned. Some of these chemicals have been found to cause health hazards, and others have been found to be carcinogens. So what is being done about this? Well, actress Jennifer Beals, along with a coalition of 450 health, environment, and business groups called Safer Chemicals, Healthy Families, is pushing for passage of the Safe Chemicals Act, a bill that would reform how chemicals are disclosed and used in products. Jennifer starred in Flashdance and The L Word, among many other appearances. She's joined today with Andy Agrejas, Director of Safer Chemicals, Healthy Families. Jennifer and Andy, welcome to the Dr. A Show.
Thank you.
Yeah, thanks.
Jennifer, why is this cause dear to your heart?
It's a cause that's important to me in that, it's also a cause that's important to so many mothers. When you have a child, your world changes in so many different ways. And I have to say, at first I was introduced to this topic before my daughter was born. I was working on a show called The L Word, and I was in the hair and makeup trailer getting ready for the show, and there was another actress on the show named Mia Kirshner who talked to some of the actresses and said, I think we should be using makeup that's free of parabens. And none of us at that time really knew what parabens were or the harmful effects of parabens. So the makeup artist, to her credit, really tried to find makeup that was paraben-free, and we all thought, well, that won't be so hard. I mean, that must be kind of obvious. You don't want to poison yourself. And she found that it was really difficult to find products that were paraben-free or phthalate-free, and so she decided to create her own. So she created a line of cosmetics called Sappho Cosmetics, and it's a really beautiful line, and that was my first introduction to toxic chemicals within cosmetics anyway. And that was really how I thought about it. I didn't really think about all of the fumes that we inhale from various things, whether they're cleaning products or, like that new car smell that we associate, with
yeah,
something
everybody
good.
likes
Actually,
that, yeah.
Maybe not, it's not something that's actually so great for your body. And then I was introduced to the fact that these synthetic turf fields with the crumbled up tire crumbs are also not good for our bodies, and especially are not good for kids who have unique behaviors. They inhale more frequently. Their dermis is not as developed as, an adult. And so in terms of inhalation, they're inhaling more particulate, and the carbon black from the tire crumb is getting onto their skin and getting into their body through dermal contact. And I just thought, wait a minute, why is all this stuff in this product to begin with? How did that happen? And the more research I did, the more toxic chemicals I was made aware of that are in products around us. And I thought, how is it that these products can come to market with all of these toxic chemicals as part of their ingredients? Which led me to the Toxic Substance Control Act of 1976.
Let me go ahead and talk about that because it was passed in, I believe, in 1970, and it grandfathered in about 60,000 chemicals. 60,000, but now more than 80,000 chemicals are in common use. And according to that, the EPA can call for safety testing only after evidence of potential danger. They can only act when the cat's out of the bag, so to speak.
The burden then is put on the consumer and on the government to prove that the chemicals are dangerous. And the government really, their hands are tied. And so it's then left to people like me and moms like me to figure out, okay, what's toxic, what's not toxic, and if it is toxic, why the heck is it there, and what can I do about it? And what recourse do I have? Which is why we need to change the regulations in a meaningful way.
Now, the EPA has been able to require testing on only 200 of those chemicals, of the 80,000 chemicals, and has regulated or banned only 5. That's very miserable. So what are you trying to achieve with this new legislation?
Do you want to talk about that, Andy?
Sure. The Safe Chemicals Act that Senator Lautenberg and Senator Gillibrand have introduced, and we're very excited to see Senator Gillibrand in the lead. I think she could become the Congress's leading mom advocate, paralleling Jennifer's activism and the activism of women around the country on this issue. But the Safe Chemicals Act would reform all the major problems in that law, and it would say that chemicals should be proven safe rather than the government having to prove harm. It would change things to be more like the way we regulate drugs in this country. To get a pharmaceutical on the market, the manufacturers to show that it's safe. And it would require them to use the sort of generally accepted mainstream medical and scientific recommendations for how to do that, that the American Academy of Pediatrics has specific proposals for how you assess the safety, and the Safe Chemicals Act would follow them. And it would also require that there be information developed for most chemicals, and that more of that information be made public, so that in addition to the government restricting the chemicals, the marketplace and consumers would have more access to information to also be able to make more informed decisions.
Now, Andy, there's about 450 health, environment, and business groups that are formed a coalition to do this. And you've worked on this for years. Are you making any progress?
I think so. I think more people have woken up to the fact that the existing laws don't protect us. The polling shows that. It attracts people from all walks of life. I mean, there's no part of the country where this agenda isn't popular. We're very active in, so-called red states. There's no red-blue divide when it comes to protecting your family's health, and that's how most people relate to this issue. So it has the support for it is both broad and it goes deeper because of that connection to health. And we've seen the legislation, the support for it has grown. It now has 29 co-sponsors. Most people think there's going to be a vote on this, at least in the Senate, in the next year. So we're definitely seeing progress.
Speaking as a mom, you have more information now. You have access to the Internet. There are more bloggers that, talk about children's health and public health in general. So you have more access to information.
Jennifer, what changes have you made in your home to lessen the exposure of these chemicals to your kids and your own family?
Well, we completely changed the cleaning products. Like it's either vinegar and water, or we use 7th generation. The cosmetics that I buy are completely different than what I bought 10 years ago. Lotions and things my daughter gets, I think, when she comes to the grocery store with me, it's really about reading labels, and I've taught her to read the labels.
Good.
And she'll tell me certain things that we can't have. Oh, no, that has this in it, or that has that in it, or what is this? Because she can't pronounce it and I can't pronounce it. And then we go home and we look it up and figure out what it is. So there's all kinds of changes that we've made.
Now, a lot of people listening say, well, toxic substances, chemicals, I mean, none of that makes any sense to me. Let's give one of these toxic substances a name so it brings it closer to home. Andy, what is BPA and how is that harmful?
BPA, it's a really interesting story for how much the system doesn't work. This is a chemical that was originally developed as a horse fertility drug. It was used way, way back when.
Right.
And people later realized you could make plastics out of it and make resins. And then it found a wide uses in the economy through polycarbonate plastic, that super hard plastic, and then the resins that lined cans and even certain fillings, tooth fillings. It's used in a lot of different places, but BPA mimics estrogen. It's a very potent hormone disrupting chemical. They call them endocrine disruptors for the system in your body that secretes hormones. And hormones regulate so many things about how we develop as human beings. So BPA has been linked to all kinds of things. It's remarkable. It's been linked to obesity. It's been linked to early puberty. It's the list of things that it affects are profound because at very low doses it affects the developing fetus and developing child in ways that might manifest themselves much later in life. So that's just an example of a very ubiquitous chemical. The Centers for Disease Control basically say that everyone that they've tested is exposed to it, and because it doesn't build up in your body, it doesn't sort of accumulate over time. That means that you're being exposed to it constantly, because they basically found it in everybody they looked at. So it's something as ubiquitous as lead, even though it doesn't build up, has these effects at very low doses and is connected to some of the health impacts that we're seeing more of in the American population.
Now, Jennifer, how can other mothers out there help?
I think, you have to let your senator know how you feel. You have to let the powers that be know how you feel. I think what we have been doing, what a lot of mothers that I know have been doing, is trying to shop around it. You're trying to educate yourself to shop around it, and it gets really tiresome. And, it's really difficult to keep up with all the latest information. With synthetic fields, you associate them with pro football. You associate them with health. And then, you do a little bit of research and you realize that the tires, the crumpled up tires that serve as the infill, are being repurposed and not necessarily recycled. And, in terms of chemicals, there's all kinds of polycyclic aromatic hydrocarbons, which are, many of which are known carcinogens. And and that's not okay. So I think it's not only changing your own shopping behavior, but it's letting your representatives know that this is not okay and that you will not allow your family to be systematically poisoned in this way.
Andy, for more information, where can our listeners contact you?
Yes, it's saferchemicals.org. Just saferchemicals.org. We have a lot of information about the policies, the health effects, and how to get involved on the website.
Well, Jennifer and Andy, I thank you very much for what you're doing, and it's a very important cause. Thanks again for being at Dr. A Show.
Thank you.
Thank you.
Let me tell you about our Dr. A Show giveaway. As a thank you for listening to my show, we'll be giving away an iPod Nano at the end of this month. To enter, you simply need to log on to thedrashow.com and click on the Enter to Win button. Then like Dr. A on Facebook and enter your information. Now, at the end of this month, we will pick a winner at random and announce that winner on the air. So keep listening to hear your name. There's no purchase necessary to win. So again, that website is thedrashow.com. That's our show for today. And until next week, this is Dr. A wishing you a healthy and happy week.